Continuing with that debate, I recognize a member from Scarborough Agincourt.
Thank you, Mr. Speaker. Over the last few months, I have been dealing with a complex and heart-wrenching case of a 14-year-old child who was admitted to hospital for treatment due to undiagnosed mental health condition. The constituent, who is a recent refugee from Iraq, has been suffering in silence for years. She has been prescribed medication, treated without care, and sadly, even after admission to hospital, doctors and nurses dismissed the case as nothing but teenage angst. But soon after admission to hospital in North Toronto, this child lost 14 pounds in 2 weeks. She became very much uncommunicative with her family and the medical team taking care of her health. And most importantly, both the child and her family have lost faith in ever finding the help required to ensure that this young woman returns to her daily life. Another difficult case I dealt with over the summer was a middle-aged man who had for years suffered from mental health and addiction issues. He had been in and out of hospitals, homeless shelters, and mental health facilities virtually his entire adult life. He had suffered along with his entire family. Eventually, his mother could not deal with the violent outbursts and other problems that came with his illness. She was forced to have the police remove him from their home in order to feel a sense of calm and security. I stand in this House thinking of the two cases mentioned and lack of support and vulnerability that the families of these sufferers felt as they attempted to navigate a system that was foreign and alien to most patients and their families. A system that has mixed results for Ontario patients. Sometimes families have felt hopeless and sadly without a way to find healing and stability for their loved ones. Mr. Speaker, I mentioned the cases not to disparage the hard work and the dedication of healthcare professionals in Ontario, nor do I mention the stories above to highlight a case or two over many others. I mentioned the stories above to highlight the urgent need for change to ensure people with mental health conditions do not fall through the cracks. When elected, this government committed to the largest investment in mental health care in Ontario's history. Bill 116 is one of the ways in which our government is helping address some of the problems facing the most vulnerable in our society and in our province. The proposed Mental Health and Addiction Center of Excellence will lay the strong foundation we need as a province as we develop and implement our mental health addiction strategy. I know from personal experience when dealing with families facing mental health and addiction, the system can seem daunting, and the complexity of these conditions puts a strain on those trying to take care of the individual patient. The families of these patients suffer along with their loved ones and require the emotional and community support needed to ensure that everyone finds healing when seeking help from our system. This is why We are going to ensure that the compassionate care is at the center of our mental health system. Mr. Speaker, we as a government committed to putting a plan forward that would invest $3.8 billion over the next 10 years to develop and implement a comprehensive and connected mental health and addiction strategy to ensure that families and patients in Ontario are treated properly and without the delays that we as a province came to expect from 15 years of failed policies of the previous Liberal government. For example, in an opinion piece written for the CBC by Adam Kassam in 2018, he wrote, quote, "The majority of our challenges are due to a combination of government inaction and a willful go-it-alone philosophy. The growing need for mental health services has been addressed at glacial pace," end of quote. This government is acting and acting quickly to ensure the failed policies of the previous governments are not repeated. Mr. Speaker, this government is listening to professionals, patients, and families of those affected by mental health and addiction. We are also aware that those problems cannot be solved by waving a magic wand. As a result, we are working hard to ensure that while we work to solve problems associated with mental health and addiction, we need to work on patient care and the experience of those seeking help from our healthcare system, regardless of where they might live in this province. The first step to solving our challenges is a system as complex as mental health and addiction requires data, performance indicators, and common infrastructure to share evidence and set service expectation. Our Center of Excellence will provide us with these exact tools. The goal of this work is to standardize the quality and the delivery of mental health and addiction services across Ontario and to provide a better and more reliable patient experience. Mr. Speaker, in addition to centralized Center of Excellence, we know that Ontario families are suffering from the opiate crisis that has been harmful not to those using the drugs only, but to our society as a collective. We have lost for far too many individuals in communities around Ontario to the scourge of opiate addiction. I know that the people in my riding of Scarborough Agincourt have spoken to me about their experience as they navigated a system with their loved one due to mental health and addiction illnesses. And they have said it is not working for their loved ones. We as a government have heard the people of Ontario loud and clear. They are demanding action against those who manufactured and distributed addictive opioids. It would allow Ontario to join British Columbia in legal action against those that manufactured and distributed those substances in our province. Any award from these lawsuits will be invested in mental health and addiction supports in communities across Ontario. We are restoring respect to taxpayers and their hard-earned dollars. And we will ensure that manufacturers and distributors responsible will pay for this litigation and throughout award settlements. Mr. Speaker, finally, I want to assure those living in Scarborough Agincourt and everyone else in this great province that we are listening and we are taking action to help ensure that most vulnerable in our communities are protected by the action we will take if Bill 116 passes. To the child in the hospital and the family of the middle-aged man seeking support for their mental health conditions, we have heard you loud and clear, and we will help you find healing and support. Thank you.